Hi friends, welcome back. This is Dr. Mavish. I am back with a much awaited video. So it is packed with loads of useful information for someone who is interested in pursuing their career in UK. Sorry for the delay, but it took me slightly long because I had to compile so much of information in a very concise and clear manner for you. So hope you find it useful. So let's get started. These are the things that I'll be sharing with you today. My story in brief, what led to the formation of Meteor Teeth, challenges faced by an overseas dentist in UK, the different routes to migrate to UK, about the visa issues, about shifting from post-study work visa to UK citizenship, about the finance, that is how much you need to be spending on these different routes, registration exams to practice as a dentist in UK, registration with the GDC as a hygienist or therapist, the different opportunities for overseas dentists in UK, about the job market, and ultimately the key takeaways. So just a bit about myself. My name is Dr. Mavish Khan. I did my BDS from India and then I moved to UK on a spouse dependent visa to join my husband here. I am a GTC registered dental therapist and hygienist and I'm happily working here since the past 2 years. Also, I'm currently pursuing ORE, LDS and MFDS exams. So what led to the formation of Meteor Teeth? Well, there were times when I felt that I wish I had somebody to guide me. In a totally different country, in a different system, I can completely understand the struggle an overseas dentist goes through. So that was a time when I decided that in future, if I would be in a position to help others, I would definitely do it. So through this channel, I just want to share my knowledge and experience with an aim to guide you in the right direction. Because I strongly believe that we should be the change that we want to see in the world. So I just want to make that journey a bit smoother for other candidates who are in the similar position as I was in the past. And of course, I'm passionate to promote oral health, and that's why I create some content which is beneficial for the patients as well. So what are the challenges faced by an overseas dentist? Firstly, you need to consider on what visa you will be migrating to UK. So I'll be talking in detail about the different visas, about the restrictions associated with it, also about the registration exams to practice as a dentist, and then how much you need to be spending on an average to pursue your career in UK. So mainly these are the types of visas on which a person can migrate to UK, and I'll be explaining in detail about this. But before we move on, let me tell you that I'm not any expert to discuss about the visas, but these are the few things that I have understood after residing here in UK for many years. But I would definitely advise you to go through the government website for yourself, and because things can always change, so it's always best to refer to the official website. Let's see what is a spouse dependent visa. A person can migrate to UK on this visa if their spouse is on a work visa in UK or is a British citizen. So this is one of the simplest and straightforward visa. You can easily appear for ORE or LDS exams or work as a dental care professional, that is as a hygienist or therapist, without any issues. Because on this visa you don't have any time restrictions or work restrictions. So once a person stays on this visa for 5 years, they can apply for ILR or citizenship. Let's see what is a student or student dependent visa. I understand many of you have so many queries regarding this, and hopefully after watching this video you will have a better understanding about this visa. So a person will get this visa if they are pursuing any full-time master's program or a PhD. And as you might be aware, the UK government is also providing an additional PSWV, that is post-study work visa, once you finish your course. This is the reason why majority of the students are planning to migrate to UK on this visa. But you need to consider the restrictions associated with these visa. So let me tell you PSWE is 2 years if you are coming on any master's program, and it is 3 years if you are taking any PhD. Now, on this visa, you cannot work as a self-employed. So many candidates are thinking that they will come to UK on a student visa and work as a hygienist or therapist. Let me tell you that it is really, really difficult to find work as a dental hygienist or therapist, because most of these roles are self-employed. And on student visa, you cannot work as a self-employed. So please do not rely on this route if you are planning to come to UK on a student visa. In fact, I would say that try to utilize your time when you're here on a student visa. Try to prepare well for ORE or LDS exams so that you can pass these exams and work as a dentist, because it's easier to find sponsorship for dentist. And also, alternatively, when you are choosing your master's program, I would say pursue your master's that gives you a good opportunity to find work based on your master's degree. I understand many of you have asked me which master's program you should be enrolling in. I'm really sorry, I'm not sure about this because I haven't done any masters here yet, but definitely in future, if I do, I will let you know. So I would say do your bit of research, check on Google about the different opportunities, about the job vacancies that you have for various masters. And because your time here when on a student visa will be very, very critical. You have to make sure that within those 2 to 3 years, when you're studying for your course, that you pass or your LDS exams or find work which gives you a work visa. Because if you don't switch on to work visa after the PSWE is finished, you will have to return back to your home country. Okay, so and this time won't be counted towards your citizenship. The time that you spend on student visa or PSWE won't be counted towards your citizenship. So once you switch on to the work visa, from there you need to spend another 5 years, and then you can apply for ILR or citizenship. Few things about student dependent visa is that if you're calling your family members on student dependent visa, they can work full time, which is not possible if you're on student visa. You have restricted working hours, but if you call somebody on a student dependent visa, they can work full time. The only catch here is that you can come along with your family members when you are moving to UK for the first time on student visa. But if you don't do that, then the only option you can bring your family members here is when you are on a work visa. So many candidates think that once they shift to PSWE, they will bring their family members along here, but it's not possible. So either you can call your family members when you are on a student visa when you move here for the first time, or once you switch on to a proper work visa. Hope that's clear. Next option can be of a visit visa. So a person can apply for visit visa and stay in UK for a maximum of 6 months, not more than that. So what some candidates do is that they prepare for the ORE or LDS exams from their home country, and they book the exams and just visit UK to appear for the exams. But obviously, you might need to do multiple visits because ORE and LDS exams, they are conducted in 2 parts, and especially for part 2, you might need to do a bit of courses to, especially to learn mannequin skills and for medical emergencies. So every time you visit to UK, you need to apply for the visit visa, so it can be really costly. And moreover, when you're on this visa, you cannot do any work. So hopefully, if you are planning for this route, once you pass the OR or LDS exams, generally what candidates do is that they apply for the dentist vacancies, and the sponsor will give you the work visa, and once you find such offer, you can migrate to UK and stay on the work visa for 5 years, and after that you can apply for ILR or citizenship. So about work visa, as I just mentioned, it is easier to find work visa if you pass ORE or LDS exams, because there are a lot of sponsors who can provide you work visa. And once you stay on this visa for 5 years, you can apply for ILR and citizenship. Nowadays, I'm hearing that there are a lot of candidates who are registering themselves as a hygienist and therapist, and they're hoping that they will find a sponsor who will give them a work visa for working as a hygienist or therapist. Let me remind you that this is really, really rare. I haven't seen somebody who got a work visa for being a hygienist or therapist. But I think there are some organizations nowadays who are starting to sponsor. But honestly, I'm not sure of this, and just want to advise you that please be very careful and go through their terms and conditions if there is somebody who is willing to sponsor you for being a hygienist or therapist. So generally, if an overseas dentist wants to practice as a dentist in UK, you need to appear for ORE or LDS exams. Both these exams will provide you registration to work as a dentist. And both these exams are conducted in two parts. Part 1 is theory and part 2 is practical. You can go through our previous videos to have a look regarding overseas registration exams. And sometimes there might be some candidates who may get an exemption depending upon the country of their qualifications. So please go through the GDC website to know if you can be exempted. Other option can be to register as a dental care professional, that is as a hygienist or therapist in UK. We have done so many videos in the past on this about how you can apply for the registration and about the requirements, how to fill the forms, and everything in detail. So if you're interested, please go through the links that we have also attached in the description box below. So let's talk about finance, that is how much you need to be spending to pursue your career in UK. So this is just for your reference. I'm not giving you any exact figures. This is just to help you understand that a big chunk of your money would be spent on visas, on your master's program if you're planning for this. And secondly, you need to consider accommodation, your stay here in UK, about the various courses that you might need to undertake for the registration exams. And the registration exams itself are very costly, ORE and LDS. Of course, you need to consider your tickets, and again, the dental instruments that you need to buy for the exams are very costly. Let's have a look on the different career opportunities. So you can work as a dentist, as an NHS or private dentist. For this, majority of the times, overseas dentists will need to pass ORE or LDS exams, as I have just mentioned previously. And if you're interested to undertake a specialty training, then doing MFDS or MFD exams will give you an advantage. Let me remind you, MFDS or MFD exams will not provide you registration to practice as a dentist in UK. This is just helpful if you want to pursue specialty training in the future. And if you already have an MFDS degree from your home country, then there is an option of undergoing a lengthy assessment process, but I'm not sure of this, to get your MDS degree recognized. So please check the GDC website to know more about this. The other option can be to work as a DCP, that is a dental care professional, that is as a hygienist, therapist, or a nurse. Now, we have explained about this in detail in our previous videos, so please go through the links that we have also attached in the description box below. Basically, if you register as a DCP, you can You have an option to work as a hygienist or therapist or a dental nurse. There is different scope for each role. So every role has an assigned duties that you can work. Nowadays, many candidates are asking if they can enroll in a dental nursing course from their home country. Let me tell you that this is not possible. To enroll in a dental nursing course, most of the times the course provider will ask for a visa, so you should be residing in UK to take up a nursing course. The other option can be to go into academics, wherein you can work as a lecturer or a professor. Majority of the times you will need to have a PhD for this. There is also something called as temporary registration provided by the GDC, but this is mainly for research programs or for hospital settings. I'm not very sure of this. I still have to do a bit more research on this, and hopefully next time I'll be able to explain you more about this. But if you're interested, please go through the GDC website. They have some information about temporary registration on their website. So if you are interested to get into academics, you can do a master's or PhD. Most of the time it is very, very competitive and very costly, but you also get some fundings. Please check the respective university websites to know more about the funding options. Last option can be to get into any master's program and get a job in that relevant field. You can either do a clinical or a non-clinical master's. Generally, as I mentioned, clinical master's is a bit costly and you need to be GDC registered most of the times for doing a clinical master's. Coming to non-clinical masters, these are less pricey, but please do check the job opportunities, because you shouldn't enroll in any masters just because it's cheap, isn't it? You should be planning ahead and see if that masters can provide you a work visa. So I would suggest that go through the job search websites, do your homework, and this will help you understand better. Let's talk about the job market. Many students ask me if they can easily find work in UK. So to all of you, let me tell you that there is competition, but who said it's going to be easy? It all depends on your hard work. If you are dedicated and if you are passionate to pursue your career, then definitely you will find a way. If you check on the job search websites, there are a lot of vacancies for dentist, for hygienist, therapist, and for dental nurses. Well, I have a great news for you all. I'm hoping to step up and provide in-depth knowledge of the procedures and treatments that you should be doing as a hygienist or as a therapist. So I have a plan in place, but I really need some time from my work to implement it in the form of high quality, affordable courses for you. So if you think you will be interested in this, please keep an eye on our various social media platforms so as to get all the latest updates. And keep asking questions, because only when you ask, you will have a better understanding. Every day I'm getting so many questions on my Facebook, Instagram, Gmail, and YouTube account. So I try to answer them as soon as possible, but sorry if my responses are delayed, because I'm super occupied with my work, and whenever I get time, I try to respond to your queries as soon as possible. So my advice for you will be to plan your career pathway, consider your visa status, know the pros and cons of each route, have backup options, explore opportunities, build your network. That is, the more people you know, the better idea you will have about the various opportunities. Contact the experts and get in touch with us if you have any queries, and we shall do our best to help you. That's it for today. Hope you found this video useful. If yes, please like and subscribe to our channel. And also, if you think this will be beneficial for anyone else, please feel free to share the video with them. And I'll be back next time with another interesting topic. Till then, take care. Bye.